Hello friends, I am Dr. Jaydev Panchwagh. I am chairman of Synapse Brain and Spine Foundation and founding member of Neurochirurgische Hilfe Indian, which is a Indo-German neurosurgery foundation. I have been practicing neurosurgery in Pune, India for the last 20 years and I am consultant neurosurgeon at Sahyadri Hospital, Pune. Today I want to speak about a very important topic which has been part of our work for last 15 years in a very focused manner, and this disease is also called as suicide disease. So it will give you some glimpse about how severe it is. It is commonly known as trigeminal neuralgia. It is a type of facial pain which is so severe that it has been described as the worst pain ever experienced by mankind. These are the descriptions with which this pain is coming. And please remember that there was a time when there was no answer to this pain. And because of this, people used to commit suicide rather than enduring this pain. So what is trigeminal neuralgia? Now, trigeminal is the nerve, which is a sensory nerve which supplies face, or rather carries sensations from the face. So if we divide our face in three parts, okay, just take these three fingers. This goes to the chin, this to cheek, and this to forehead. Now these are the three branches. So three branches. So it is called as trigeminal nerve, and the pain in this nerve, that's why trigeminal neuralgia. So trigeminal neuralgia is a pain in the face or forehead coming like a current. I will tell you what is a typical trigeminal pain. It is sudden. When it starts, it is sudden. It comes like a current. It lasts for few seconds or few minutes. It is extremely severe, excruciatingly severe. It has got a specific trigger factors like eating, chewing from that side, or drinking water, or speaking, or touching the face with hand or towel, or shaving. All these activities, or when you are going out on a two-wheeler or in a four-wheeler with open windows, waft of air coming and hitting against your face, that also can trigger these attacks. Now, these attacks are extremely severe. Many people tell us that they have started from either upper gum or lower gum, upper jaw or lower jaw, and then this current spreads up or down or towards the nose or towards the front of the ear. In many parts of the world, people are wrongly diagnosed with dental problem and teeth are removed for this. This is very commonly seen in our trigeminal neuralgia OPD. And I think we are all at fault because we need to educate not only the public but non-neurosurgical doctors even more. The symptoms are very typical. They are current-like severe painful attacks. Some people describe them as sudden chili powder being thrown in the eye or on the face, sudden attack of burning coming, or multiple pinpricks at one time coming. So there are different ways in which these people perceive this pain. Trigeminal neuralgia usually starts with smaller duration attacks and then goes on increasing in duration. If this is not treated in time, then this gets converted into what is called, we call as type 2 neuralgia. That is, there is continuous pain on the background, and on that background the person gets sudden attacks of pain. So this condition becomes even worse. Initially, there are few medicines which we start, but these medicines, mind you, do not treat the basic cause of the pain. These medicines will make the nerve numb. So they are like painkillers, but they are nervous system painkillers, numbing agents, or anti-epileptic agents being used for pain. These agents do not unfortunately know that it is only the trigeminal nerve that they have to target. So they affect the entire nervous system. So there are side effects which come with them. There is loss of balance while walking, memory problems, concentration problems which come with these medicines. Uh, Initially, when small doses are enough to treat the painful attacks, it is all right, patient is carrying on with his or her normal life. As the intensity increases, then the doses of the medicine go up, and the patient is caught between the problems of the medicine on one side and painful attacks on the other side. So the patient is literally sandwiched between the devil and the deep sea, so to say. So what can be done about this? For that, we have to know why this happens. Now, in majority of the patients, barring few exceptions like tumors or some medical conditions like multiple sclerosis, and some other rare conditions, the commonest cause of trigeminal neuralgia is what is called as neurovascular conflict. Now, neurovascular conflict is a blood vessel burrowing deep into the nerve, and in this case, it is a trigeminal nerve. In hemifacial spasms, where the face twitches like this, the vessel burrows into the facial nerve. Now, here in trigeminal neuralgia, it is a trigeminal nerve. So it goes on burrowing deep into the trigeminal nerve, and with each pulsations, it keeps on hitting the nerve. So the nerve becomes diseased because of this pulsatile compression almost 70 to 80 times every minute. And then the pain attacks start. So this is the cause majority of the times. Now the answer to that is what is called as microvascular decompression surgery. And here, under intense illumination of neuromicroscope, we dissect out this artery from the nerve and we wrap it with Teflon sponge. And when we do that, the pulsations stop affecting the nerve. So this is almost a definitive treatment, treating the cause at its root rather than some superficial band-aid being applied. There are other methods also which have been described, and there are some controversies in some areas of this, like radio frequency lesioning, in which we put a needle inside the nerve and burn the nerve in one area. Then there is a balloon decompression, in which a balloon is passed deep into the nerve and is inflated. The nerve is damaged purposefully, or gamma knife, in which the nerve is burnt with the rays from outside. So all these procedures are peripheral procedures. They are not targeting the exact cause of the problem. So they are all destructive procedures in essence. They are likely to be short-lived. Microvascular decompression surgery has been proven to be the surgery with the highest success rate. And I can say this with confidence because for last 15 years, we have been doing specific and focused efforts to treat trigeminal neuralgia and hemifacial spasms with microvascular decompression surgery at our MVD center. And we have performed more than 1,300 MVDs taken together in the last 15 years with the same team. That is very important, because the same team gets trained in the surgery again and again and again, and gets so well versed with the surgery that the results become better and the complications go down. In the recently concluded neurosurgical conference, we presented this paper, and I'm very happy to say that it was well received. We had 98% success rate or cure rate with MVD surgery in trigeminal neuralgia. It is our mission, so to say, to help people with this severe pain, and we want to educate people that MVD is probably the only method which directly targets the root cause of trigeminal neuralgia. and it has got a highest chance statistically in our series and in the series world over, the highest chance of cure of trigeminal neuralgia. So nobody, in my opinion, should be kept away from this information. The final decision, of course, lies with the patient about the decision to undergo surgery, to get treated in different ways. But it should not happen that the person doesn't know that he can get treated. Because even in the present era, I can tell you that there were more than 20 people that we have listed in our entire experience of 15 years who have told us that they had definitely decided to commit suicide before they found that there is a method to treat this problem. So this is how severe the pain is. This is why it is called as suicide disease. So please be aware of this problem. Please help people to get diagnosed, get treated, get cured. And if you have any doubts about this, please write to us. I will be personally, and our entire team will be very happy to answer about this problem, because it is very close to our heart. It is one of our missions in life to conquer this pain and help people. Thank you very much. I am Dr. Jaydev Panchawagh. Keep watching this channel, and we will be coming again with some new topics. Do write to us. We will try to respond with new and informative videos. Thank you.